My lower face, I'll show you a close-up of that yesterday, and my pores already look a lot better. I don't ever get Botox on my upper face because I had it once and my staff really hurt me during the injection process because they try to do a wiggle technique I do to minimize discomfort. I can't really do between my eyes because it's a much deeper injection, so I'm worried about hitting the wrong muscle by my doing myself. But the problem is my lower face, the pores have already gotten so much better in a single day that now my forehead looks not so good. So I decided I'm going to do the MesoBotox to my upper face to improve it, because that way I can control the depth of injection, not worry about going deep. But if you say, do I ever do MesoBotox for the forehead? The answer is yes, but not that often. The reason is that conventionally the upper face, I treat it with high concentrated Botox, and with high concentration of Botox I already get the improvement in not only the wrinkles but the pores texture tone. I'll probably get a little less wrinkle effacement with this lower concentration of Botox, and I'm really focused on the quality of skin, but it'll be a nice sort of evaluation over the next few months to see if I get some improvement in the wrinkles as well, because I'm certain I do. So if you say, well, when do you do it up here? I do it most commonly for patients that have hyperhidrosis, which is a fancy medical speak for over sweating. So this can manage too much sweating, and I did a video of that if you want to hear more details about that. But essentially, this in my patients that get hyperhidrosis, and I do this treatment for, I actually get pretty good results in terms of the quality of their skin as well, as a bonus. So that's one indication. Another indication is someone that has pores, texture, tone, scar tissue that they like acne scar issues that they want improvement on. I will do the treatment with MesoBotox, because conventional Botox can work, but sometimes a very superficial dilute injection is more powerful for that. So sort of textural issues if I'm doing it in combination with a full face treatment. What's interesting though is I've actually managed traumatic scars and also issues with quality of skin with just regular plain Jane high concentrated Botox as well. So I'm just doing this, as I said, mainly because I don't trust anyone to inject me, and so I'm injecting myself with a dilute Botox mainly for quality of skin texture, and as a bonus I may get a little bit of some wrinkle reduction as well. I am happily married, 50-some-year-old gentleman, heterosexual, so I'm not trying to get every wrinkle gone. I'm about to do a video called Botox for Men, where I delineate what are my psychosocial improvements for men. And actually, I will go through all that with you in a separate video. But suffice it to say, my major objective with this is a little bit of wrinkle reduction. I don't need to have no wrinkles, but it's also just overall a better quality of skin that looks healthier. I've had some sun damage, as you heard me decry the negative ravages of sun on people's skin. Well, I don't live as a hermit. I just got back from Mexico last week, so I'm just putting a little bit in here to improve the quality of skin. So I'll show you once I'm done with this injection what I look like. You can stop it. Okay, so I've just finished mesoing, Botoxing my forehead. You can see the little bumps there. That's normal. This will go down in about 10 minutes or 20 minutes at most. My face, this is a day out. I really don't have any bumps or scabs. My pores are already about 1/3 the size, which is really pretty cool. Sometimes you'll have little tiny dots like freckles for 1 or 2 days, but I don't really see that in my face.